Hospitals across Arizona are desperate for help right now, and some ICUs, Jared, they're at like 90% capacity.
And a number of hospital officials were direct with the governor this week, saying it is getting worse for them day by day, and they're asking for action this week. Carissa Planup live with more on what our hospitals are asking for. Carissa?
A number of hospital leaders, including the head of Banner here, sent this letter to Dr. Kara Christ, our state health director, yesterday, outlining a list of COVID-19 mitigation measures, including a statewide curfew. Today, Governor Doug Ducey dismissed the idea of curfew, saying he would much rather focus on enforcing the rules that are already in place.
A curfew is absolutely a mitigation that can work. It will work, and it'll work if we do deploy it. And we should consider doing that in places outside of just Tucson.
Banner's chief clinical officer applauding a 10 p.m. mandatory curfew approved last night by the Tucson City Council. Dr. Marjorie Bessel, one of 8 healthcare heads, urging state leadership to step up mitigation plans and do it now.
We risk not being able to have a healthcare system that is there to take care of the patients who will need us.
In a week, Bessel says, Banner will likely be using all its licensed beds, which means patients may be sent outside their communities to any Banner location that has room. Staffing continues to be a concern. Valleywise Chief Medical Officer Dr. Michael White is trying to hire healthcare workers that can fill critical gaps.
As staff may become exposed or staff may become sick, we need to be able to continue to sustain our operations and deliver care.
White also signed off on the letter to Dr. Christ, asking for a stop to indoor dining, capping gatherings at 25 people, halting group athletics, and a 10 p.m. curfew. The Valleywise ICU is now 90% full.
What would happen if we do nothing is terrible, and it would result in many hundreds, if not thousands, of needless deaths.
Dr. Joe Gerald works on the COVID-19 modeling team at the University of Arizona. He says hospitals will reach a breaking point before Christmas. Gerald suggests we need strategies that can be enforced.
I don't think voluntary measures on their own will necessarily get the job done, given the size of the problem we face today.
Today, Governor Doug Ducey did announce that the state is committing $60 million to help hospitals staff up. At the same time, the head of Valleywise is saying we could see the fallout from those Thanksgiving holiday gatherings very soon. He says we can expect those cases to start ticking up at the end of the week. Reporting live in Phoenix, Carissa Planup for Arizona's Family.
Certainly seems like the hospitals were expecting a bit more from the governor today. Carissa, thanks for following that.